All right, so a little bit off topic. The video mentioned in the comment is not an arterial stick. However, I think it brings up an interesting question. If I were to, why would I ever insert an arterial puncture needle with a 90-degree approach? Depending on the patient's condition, especially if they are on multi-pressors, it's going to contract that vessel really hard. With relaxed vessels, veins especially, when we touch the tip of that vessel, the tissue dimples a little bit. It creates a small divot and allows us to focus the vector or the direction of that needle more easily towards the center of the lumen. However, if it's nice and tight and really hard from the vasopressors and it vasoconstricts those arteries, it becomes very difficult to puncture because there's no indentation or divot to redirect that needle towards the center. And so when we try to poke it, it'll just move that vessel out of the way because it's so hard. Imagine this. It's the difference between poking a balloon, a long balloon, with a knife versus puncturing a hard tube with a knife. What happens to that tube? That tube's not going to get cut. It's going to get moved. Same difference with a contracted, very highly contracted artery versus a looser artery. Now, what sucks is that why do we need an art line? It's most likely because they're on pressors. So it's always going to be difficult. So with that 90-degree approach, there's less redirection of that needle when we're trying to tap that vein. So it's easier to puncture a harder vessel with a lot of column strength in a 90-degree angle than with a lower angle of approach. Hope that helps.